Hello and welcome back to the channel. On today's Wellness Talk, we will review a very common condition seen in the clinic, acid reflux. It is also called gastroesophageal reflux disease, or GERD, and is the most common gastrointestinal disorder with an estimated prevalence of 20% of adults in Western countries. If left untreated, GERD can lead to breakdown of the protective layers of the stomach and esophagus, leading to scarring and tissue changes that can develop into cancer. Today we will review the anatomy of the stomach and esophagus. We will review what GERD is, including risk factors and symptoms. Finally, we will discuss diagnosis and treatment options. The following information is meant to be a resource but not medical advice. Opinions are my own but based on over a decade with direct patient care. Please consult your primary care provider for any questions or concerns. The digestive system is a complex network of organs responsible for breaking down food into nutrients that the body can absorb and utilize for energy and growth. Two crucial components of this system are the stomach and esophagus. The esophagus is a muscular tube that connects the throat to the stomach, allowing food to pass from the mouth to the stomach for digestion. At the lower end of the esophagus lies a specialized muscular ring called the lower esophageal sphincter. This sphincter acts as a valve, opening to allow food to enter the stomach and then closing tightly to prevent stomach contents, including acidic gastric juices, from flowing back into the esophagus. This mechanism is essential for preventing acid reflux, a condition in which stomach acid irritates the lining of the esophagus, leading to symptoms such as heartburn and regurgitation. Beyond the lower esophageal sphincter, the stomach serves as a reservoir for food storage and initiates the process of digestion by secreting gastric juices containing enzymes and hydrochloric acid. Heartburn, or GERD, occurs when stomach acid flows back into the esophagus, irritating the lining and causing inflammation. The main symptom of heartburn is a burning pain that may radiate from the chest to the throat. Patients may describe regurgitation of sour-tasting fluid into the mouth, difficulty swallowing, chronic cough, hoarseness, and sore throat. Heartburn symptoms are often worse after eating, lying down, or bending over. While occasional heartburn is normal, frequent, or persistent, symptoms may indicate a more severe form of acid reflux that requires medical attention and treatment. Several factors contribute to an increased risk of experiencing heartburn, including demographic trends, lifestyle choices, and certain medical conditions. Although the reasons for this are not fully understood, men tend to have a slightly higher risk of heartburn compared to women. Smoking can weaken the lower esophageal sphincter, making it easier for stomach acid to reflux into the esophagus. Obesity is another significant risk factor, as excess weight can increase abdominal pressure, promoting acid reflux. Eating foods that are significantly spicy, acidic, or fatty, as well as excessive alcohol and caffeine intake, are known to exacerbate heartburn symptoms. Pregnancy can contribute to heartburn due to hormonal changes that relax the lower esophageal sphincter and the increasing pressure from the growing baby. Individuals with certain medical conditions such as hernia or connective tissue disorders may be more prone to experiencing heartburn. The following symptoms are common in GERD. Heartburn, a burning sensation in the chest, often after eating or when lying down. Regurgitation, sour-tasting fluid backing up into the throat or mouth. Difficulty swallowing, sensation of food sticking in the throat. Chest pain, sometimes mistaken for a heart attack. Chronic cough, especially at night. Hoarseness or sore throat, caused by acid irritation of the throat. Bad breath and dental carry signs of worsening condition that need urgent attention, include blood in the stool or dark tarry stools. Weight loss, change in bowel habits, vomiting blood, or difficulty swallowing. Anyone who is over 50 with a new onset of symptoms should be evaluated by their primary care provider, as they may be at an increased risk for cancer. Testing for acid reflux involves several methods aimed at assessing the severity of the condition and identifying underlying causes, playing a crucial role in guiding treatment decisions and monitoring disease progression. One common testing option is pH monitoring, which measures the amount of acid in the esophagus over a 24-hour period. This test provides valuable information about the frequency and duration of acid reflux episodes, helping healthcare providers plan appropriate treatment strategies. pH monitoring can be performed using a catheter, inserted through the nose, or a wireless capsule attached to the esophageal lining. Another important test is H. pylori testing, which detects the presence of Helicobacter pylori, a bacterium associated with acid reflux and other gastrointestinal conditions. Testing for H. pylori may involve blood tests, breath tests, or stool tests, with antibiotic therapy recommended if the bacterium is found to alleviate symptoms. Additionally, upper endoscopy, also known as EGD, allows healthcare providers to visualize the esophagus, stomach, and upper part of the small intestine using a thin, flexible tube equipped with a camera. EGD can identify inflammation, strictures, ulcers, or other abnormalities in the esophagus or stomach contributing to acid reflux symptoms. Biopsies obtained during the procedure can help rule out conditions such as Barrett's esophagus or esophageal cancer. In some cases, imaging studies such as barium swallow or esophagram may be recommended to evaluate the anatomy and function of the esophagus. These tests involve swallowing a contrast material that highlights esophageal structures on X-ray images, aiding in the identification of structural abnormalities or motility disorders contributing to acid reflux symptoms. Overall, a comprehensive evaluation of symptoms and medical history, along with these testing options, allows healthcare providers to accurately diagnose acid reflux and develop personalized treatment plans tailored to each patient's needs. Managing acid reflux involves a multifaceted approach aimed at alleviating symptoms, reducing acid production, and preventing complications. Lifestyle modifications play a key role in symptom management, including maintaining a healthy weight, avoiding trigger foods, eating smaller meals, and elevating the head of the bed during sleep. In addition to lifestyle changes, medications are often prescribed to help control acid reflux. Antacids provide quick relief by neutralizing stomach acid, while H2 receptor blockers or proton pump inhibitors reduce acid production in the stomach more effectively. For individuals with severe or persistent symptoms that do not respond to lifestyle modifications and medications, surgical interventions such as fund application or placement of a Lanx device may be considered to strengthen the lower esophageal sphincter and prevent reflux. Here are some tips that I often discuss with my patients. These are things that may help you to manage reflux on your own. Elevate the head of the bed. Sleeping with the upper body elevated can reduce nighttime reflux. You can accomplish this by lifting the head of your bed 6 to 9 inches with a wedge or blocks under the mattress and box springs. The ideal elevation is around 30 degrees, but using pillows to elevate your head has not been found to be effective. Do not smoke. Avoid certain foods that can trigger symptoms like spicy food, tomato sauce, alcohol, fatty or fried foods, mint, garlic, onion, caffeine, soda and coffee, and chocolate. Wait 3 hours after a meal before you lie down. Eat smaller meals and avoid tight-fitting clothing. If you use an H2 blocker or PPI, remember to take these on an empty stomach. See your primary care provider for suggestions on medications that would be effective for you. Acid reflux is a common condition that can significantly impact quality of life if left untreated. By understanding the symptoms and treatment options, patients can take steps to manage their condition effectively. Telehealth offers a convenient and accessible way for patients to receive expert care and support, empowering them to take control of their health and improve their overall well-being. If you're experiencing symptoms of acid reflux, don't hesitate to reach out to a healthcare provider for guidance and support. If you would like to learn more about esophageal reflux and about wellness, please stop by our website. And if you enjoyed today's talk, please hit that like button and subscribe to the channel to be ready for our next video. As always, from my home to yours, wellness is a journey, not a destination.